If you're experiencing occasional constipation, adult Glycerin Suppository, Rectal can help. It belongs to a class of drugs known as hyperosmotic laxatives, which work by drawing water into the intestines. This usually results in a bowel movement within 15 to 60 minutes. For adults, the normal frequency of bowel movements varies from once daily to 1 to 2 times weekly. It's best to treat constipation by drinking plenty of fluids, eating foods high in fiber, and exercising regularly. When using adult Glycerin Suppository, it's important to remember that this product is for rectal use only. Make sure to read and follow all directions on the product package, or use as directed by your doctor. If you have any questions, ask your doctor or pharmacist. If the suppository is too soft to insert, chill in the refrigerator for 30 minutes or run cold water over it before removing the foil wrapper. Before and after using this product, wash your hands. If the medication is wrapped in foil, remove the foil wrapper. You can moisten the suppository with lukewarm water, but do not use petroleum jelly or mineral oil as this may cause the product to be less effective. To use the suppository, lie on your left side with the right knee slightly bent and gently insert the suppository well up into the rectum, pointed end first. After insertion, try to stay in position for 15 to 20 minutes until you feel a strong urge to have a bowel movement. The product does not need to melt completely to produce an effect. If you are helping a child use this product, have the child lie on their side with the lower leg straightened out and the upper leg bent toward the stomach. Gently insert the suppository into the rectum, pointed end first, and have the child stay lying down for 15 to 20 minutes if possible to keep the suppository from coming out. Remember not to use this product more than once daily unless otherwise directed by your doctor. Overuse can lead to loss of normal bowel function and an inability to have a bowel movement without using the product. If you notice symptoms of overuse, such as diarrhea, abdominal pain, decreased weight, or weakness, contact your doctor promptly. And if you do not have a bowel movement after using this product or if you think you may have a serious medical problem, consult your doctor promptly. When using adult Glycerin Suppository, Rectal, you may experience some side effects such as rectal irritation, abdominal discomfort, or small amounts of mucus in the stool. If these effects persist or worsen, it's important to consult your doctor or pharmacist. If your doctor has prescribed this product for you, it's because they have determined that the benefits outweigh the potential risks of side effects. Most people using this product do not experience serious side effects. However, it's crucial to seek medical attention if you experience severe or persistent abdominal pain, bloody stools, or rectal bleeding. Additionally, prolonged diarrhea can lead to dehydration, so it's important to contact your doctor if you notice symptoms such as decreased urination, dry mouth, fast heartbeat, or dizziness. Although rare, a serious allergic reaction to this product can occur. Seek immediate medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned, it's best to consult your doctor or pharmacist. Remember, in the US, you can call your doctor for medical advice about side effects or report them to the FDA. In Canada, you can also call your doctor for medical advice or report side effects to Health Canada. Before using adult Glycerin Suppository, Rectal, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Before using this medication, be sure to inform your doctor or pharmacist about your medical history, especially if you have any of the following: rectal bleeding, intestinal blockage, other bowel problems, or current stomach/abdominal symptoms such as nausea, vomiting, pain, or cramping. If you have experienced a sudden change in bowel habits lasting more than 2 weeks, or if you need to use a laxative for more than 1 week, it's important to consult your doctor as these could be symptoms of a serious medical problem. If you are pregnant, this medication should only be used when clearly needed. Be sure to discuss the risks and benefits with your doctor. It is also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. Remember to always follow your doctor's advice regarding the use of this medication. It's important to be aware that using adult Glycerin Suppository, Rectal may interact with other medications you are taking. This could affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you are using, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. They can provide guidance on whether it's safe to use adult glycerin suppository, rectal with your current medications. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If this medication is swallowed, it can be harmful. If someone has taken too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 or a poison control center immediately. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can reach out to a provincial poison control center. For using adult glycerin suppository, rectal, it is important to know that it is typically used to relieve occasional constipation. It works by causing the intestines to hold more water, which softens the stool and makes it easier to pass. This medication is for rectal use only. Follow all directions on the product package. If you have any questions, ask your doctor or pharmacist. For best results, this medication should be used as directed by your doctor. The usual dosage is 1 suppository inserted into the rectum as needed, or as directed by your doctor. The suppository is typically effective within 15 minutes. For the best timing, it's recommended to use this medication at bedtime if using it for constipation. Make sure to not use more than 1 suppository in a 24-hour period. Remember to keep all your medical and lab appointments. It's important to use this medication as directed by your doctor and to follow up with any recommended appointments. This will help ensure that you are getting the full benefit of the medication and that your health is being properly monitored. Adult glycerin suppository, rectal, is used to treat constipation. It works by increasing the water content in the stool, making it easier to pass. This medication is for rectal use only. Follow all directions on the product package, or use as directed by your doctor. If you are uncertain about any of the information, consult your doctor or pharmacist. To use the suppository, unwrap it and moisten it with a little water. Lie down on your left side with your right knee bent. Gently insert the suppository pointed tip first into your rectum, about 1 inch for an adult. Stay lying down for a few minutes. The suppository will melt quickly and you should feel little or no discomfort while holding it in. Avoid using the bathroom for at least 1 hour after using the suppository. The best time to use this medication is before bedtime or after waking up in the morning. The daily dosage for adults is 1 suppository, but it is important to follow the instructions on the product label or as directed by your doctor. When storing adult glycerin suppository, rectal, make sure to check the package label for storage information. It's important to protect it from high heat and avoid storing it in the bathroom. If you're unsure about how to store it, don't hesitate to ask your pharmacist. Remember to keep all drug products away from children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly dispose of it when it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.